Welcome to Heme Consults Orientation video number 9. Today I'm going to be talking about strategic communication. And strategic communication is important communication that directly affects patient care. There'll be a lot of communication that's going on throughout the day that may or may not be strategic. I think it's important because I remember a time when I was on the consult service and there was a specific recommendation that had been made by hematology the previous time the patient was in the hospital. We couldn't find a note in the chart. And so they kept saying, well, hematology said we shouldn't do it. And there was just no documentation about it. And it was clearly written in the chart that hematology said. There was no note from hematology, and no one could even figure out who the attending was. So it didn't quite work like it was supposed to. And so I'm here to talk to you about 7 things to think about that count as strategic communication and things that do not. The first point of strategic communication is your communication with the team, as they call the consult. Now, it's strategic because you can use that opportunity to maximally get the information that you need to help in the care of the patient, so you don't have to do double work, listen first, and then go back and look up all the story that you should have gotten on the phone. So it's strategic because you want to use it to your advantage. Not only do you want to use that opportunity to get the information about the patient, but you also want to use the opportunity to write as much of the note as possible. So if you're able to handle it while the team is talking, be typing in the chart. And if you're not able to handle it, wait until you get off the phone. And before you get to answering the next page, wait and just put all the thoughts down on paper. And that is the first point of strategic communication, the consult call. The second point of strategic communication is a conversation you have with the patient and or their surrogates. This communication is strategic because it allows you to get the nuances of the patient history that the chart doesn't give you. For example, are they adherent to their medication? Did they miss a chance to pick up a refill prescription due to illness or other? These are the kinds of things that may not be clear in the chart, especially if someone has not been detailed about taking a hematologic history that's relevant for our purposes. So the second point of strategic communication is your communication with the patient. The third point of strategic communication is your conversation with the literature. You are having a conversation with the literature. You want to know, how has this patient or similar patient been treated in the past, and how does it inform our management of the patient? So definitely making sure that you're conversant with what the literature said about treating this patient is important. Okay. The fourth point of strategic conversation is really presenting to the attending. So why this is strategic is because you're sharing all the information that you've gathered from the patient and your thought patterns, and that allows the attending to figure out what's going on with the patient so that they can figure out the assessment and plan, or at least whether they agree with yours or not, and also so that they can figure out your thought process. The next point of strategic communication is really eliciting the attending's thoughts. So you've had a chance to present the case, you have shared your thoughts, and then you want to hear, what does the attending think? And you really, really do want to use that strategically because you want to get the attending to lay out for you what they're thinking. So it's not enough for them to say, oh yeah, apixaban is the answer. Like, so why did you choose apixaban over rivaroxaban in this patient who has renal insufficiency? Those are the kinds of questions you want to ask. And if the attending somehow has done like quick math in their head and figured out the answer and just blurted it out, you want to say, hey, can you slow it down? And then make explicit the kind of calculations you're making in your head to come up with this diagnosis. So you want to be strategic about that communication. Number 6 is communicating your recommendations to the team. So this is the point at which you've seen the patient, you've talked to the attending, you know exactly what to do. And sometimes I see this happen via text message. And you know, what's important, especially as you are helping facilitate the care of patients through other providers, is that they understand the way you're thinking. It's not enough to just say, do X, Y, Z, do 1, 2, 3, 4, and for that to be enough. You can communicate that kind of information by text and it'll be fine. But in reality, what you really want to do is communicate to the team, well, because we saw this, we felt like it was important for us to also evaluate for this. And for that reason, we've recommended 1, 2, 3, 4. And so it's strategic because you're not just giving the team a list of things to do, which is disconnected from your thought process. You're connecting your thought process to the information or the requests you're making as far as what tests they need to order. And so it's important because if something gets lost in the exchange, they'll say, oh, I got 1, 2, 3, but I missed number 4. But if you explain the thought process, then they will logically come to a conclusion that a piece of it is missing because you've helped them understand that. So be strategic about communicating, and especially it's best when that communication happens verbally. The last point is writing the detailed note in the chart. This is important because the note really serves as a point of communication. Yes, we focus on notes a lot as a tool for billing, but it primarily serves as a tool for communication between providers. And so you want to make sure that the parts of your note that are most strategically clear are the assessment and plan. Don't waste too much time on the HPI. Write the things that are most relevant to hematology, but definitely focus on the assessment and plan, and not just writing a bulleted list of things that people should do, but really explaining your thought process. It's helpful if you have dictation capabilities so that you don't have to necessarily type out your thought process. You can just dictate it, which tends to be faster than if you're trying to type it out. Okay, I've talked to you about 7 points of strategic communication. What about communication that's not strategic? I'm going to give you some examples of communication that I consider not to be strategic, because although they're kind of centered around patient care, they're not directly affecting patient care. Number one, answering questions about processes. So when the team calls and they say, can you tell us how to order a CBC with diff again because we've forgotten, the sub-I doesn't know? Not your problem. It's not that you don't help them address that. You're such a kind person. Of course you will. But if they are interrupting your flow of thought, you're in the middle of a note and you get this call that comes across the phone, interrupts your flow of thought to ask you how to order a CBC that somebody else on their team could tell them, it's just not a great use of your time. It doesn't maximize your capabilities. And so it doesn't mean you don't have those conversations, just defer them to a later time when you are able to answer those questions. Don't let the team's urgency in calling you become your urgency as well. Another thing is scheduling appointments. And so many times you call to schedule an appointment, you're on the phone, they're playing beautiful music, but it's still wasting your time. Think about how to most efficiently request and communicate appointments, and definitely think about ways to prioritize doing it by email so that you're not having to spend time listening to music on the phone. The other thing is texting recommendations. So it's non-strategic because it takes time to text. You text and then the team texts back and says, wait, we didn't get that. Why did you order this? But we already ordered this. Should we? There's a lot of back and forth as opposed to picking up the phone and having a 2-minute conversation, and it saves you time. So think about how text messaging through Epic especially can be a distraction and not always strategic. Also, if there are outpatient requests, when you're on the Heme Consult service, it's the inpatient Heme Consult service. But invariably, an outpatient person will call you with a question. In fact, it may even be a patient from your VA clinic. And it's really important that you remember that you should have that conversation, but maybe have it at the end of the workday and don't allow it to interrupt your flow of thought. Okay, the last thing I would say that's not strategic is tracking down outside records. You need the information, you need to understand it, but you know what? So does the team as well. They have a big team, and for the most part, you don't have as many hands on deck to do those kinds of things as they do. So delegate to them to do the things that they can do so that you are liberated to do the things that you can do. All right, so that's all I'm talking about with strategic communication today. This week, I want you to take action and think about engaging in communication strategically. How might you eliminate all those distractions that come in the form of constant phone calling or constant Epic chart messaging from the teams that interrupt your flow of thought and slow you down? Think about how it would be 4 weeks from now if you can say that you maximize time effectively and you become an effective strategic communicator. All right, I'll see you in the next video.